Hey everybody, Dr. Julie McLaughlin here with McLaughlin Care, and it's Functional Medicine Friday. So this is our last week talking about the risk assessment. So we're going to go through our last 5 questions. If you'd like to take the risk assessment in full, you can go to our website, McLaughlincare.com, and take the risk assessment. Just fill out the questions. It will grade it for you and give you your results immediately after you take it. So be sure to check that out. So if you've been following along, you know we are on question number 15 this week. Do you have diabetes or high blood sugar? So that's going to include prediabetes, insulin resistance, metabolic syndrome. So if you do, type 1 diabetes and type 2 diabetes, people who have those are 2 to 4 times more likely to develop cardiovascular disease than people without diabetes. Now, we know that type 1 diabetes is genetic and it's an autoimmune, and it's nearly impossible to not contract that because it's in you. But type 2 diabetes, that is adult onset or caused with a fork and a knife, right? So we need to really make sure that we are monitoring our blood sugar and having that monitored, because diabetes is a horrific disease in itself, but it causes a disease that will kill us: heart disease, heart attack, stroke. So we want to really, really manage this really, really well. We can do it with lifestyle. We can do it with supplementation. And in patients who have severe cases, they need to manage it with medications and insulin. So risk number 16, do you have any kind of pain, right? Any kind of pain? Yes, a couple times a month, maybe a couple times a week, or maybe every day, or more than a couple times a week, right? So inflammation is what causes pain, and inflammation leads to all chronic disease. It is the underlying cause of chronic disease, and it raises your risk of having a heart attack by 45%, right? Wait, like 45%? I have a neck pain, and that can help contribute to having a heart attack? Yeah. So if you have inflammation going on, come in and see us. Let us help you get rid of the pain in the neck or pain in the whatever you have, to try to get rid of that inflammation and the pain, because it will help save your heart, right? So that's a really big one. So let's talk about healthy relationships. Number 17, do you have healthy relationships and a rich social network of friends and activities that you do? If you absolutely agree, that is really awesome. If you don't, and your depression is a really big result of this, and you can double your risk of having a heart attack from depression and not having a good social network and a good community that supports you. So I want you to try to get involved in some things in your community, and we can talk and try to help you get a little bit more into that group and network of activities and friends. So how about number 18? Do you drink alcohol? Now, alcohol is a really tricky thing. Some people, alcohol is a no-go. Not having any, never, right? And other people can actually tolerate some. So the average for a man is 2 drinks a day, every day of the week. Now that seems like a lot, doesn't it? And women is 1 drink a day, every day of the week. So if you're drinking more than that for a man or a woman, you are definitely excessively drinking and you're at risk. Now, I am telling you, it's a 1 drink size. Like, don't have a glass of wine where it should be this much and you're doing this much and calling it 1 glass, right? That's not counting for you. Because if you're drinking excessive alcohol, it's 1 to 2 times increased risk of cardiovascular disease, mortality, death, right? And it increases your risk of all forms of stroke. So a little bit of alcohol is okay for some people, it's not for others, but too much alcohol is not a good idea. So number 19, do you eat meals or snacks that contain sugar in any forms, like cookies, cakes, candies, pastas, sugar-laden sauces such as ketchup and breads? Yep, ketchup has a lot of sugar in it, doesn't it? So do a lot of those processed yogurts. So if you're eating sugary snacks, guess what? You are going to be more likely to have diabetes, metabolic syndrome, which is a combination of diabetes and heart disease, and 2 to 4 times more likely to develop heart disease than a person without diabetes. So we need to put a nix on these sugary snacks. And question number 20, are you taking medication for chronic medical problems such as digestive disorders, cardiovascular problems, high cholesterol, headaches, chronic pain, blood sugar, problems with fatigue, immune problems, chronic infections? It doesn't matter. If you're taking lots of medications or any medications, you know you're at risk because you're taking the medications because you have a problem. And taking a medication is associated with 22% greater risk for transitioning from robust health to death. So if you're having a medication, let's look at what's causing the problem and work on the cause rather than treating just the symptom. So that is it for our 20 questions in our risk assessment. And you might have one risk or you might have multiple risks. But no matter however many you have, we want to work on them. So make sure you check out our supplement shop on McLaughlinCare.com/supplement-shop. We have 24 different packs that are very specific. We have blood sugar control, joint pain. We have women vitality, men vitality, hair and nails, you name it, it's on there. And I formulated all these packs with pharmaceutical grade supplements that are of the highest quality that we use here in our clinic, but these are just condition specific. So if you're worried about one thing, this is a good way to look at it. Remember, we look at the labs because your physiology is what we look at to predict and prevent chronic disease. So how can you change your risk? You're going to eat better, move better, think better, and sleep better. And you know, we are always here to help you with your risk assessment, your blood pressure, your posture, your body composition, your core strength and flexibility, your spine, and blood tests, of course. So that's it for Functional Medicine Friday. I will see you all next week.